So Orion Health is a software company that operates globally. We've got 27 offices in 15 countries around the world. We specialise in three main product areas. One is an integration engine, another one is running a whole hospital end-to-end, and the last one, and probably the jewel in the crown, is our population health management software, which really looks at managing population risk, and creating efficiencies across the whole health system. So we've got different competitors in every market. One of our key competitors globally is a company called InterSystems. We also have local players that we compete with, and what we differentiate, or how we differentiate with most of our competitors, is our vision and strategy around use of technology, open technology that integrates to any other system, and our use of big data. So being able to manage large amounts of information for what is going to be a massive information growth age in healthcare. Our key growth initiatives, we're very much focused on winning as many deals as we can at the moment to grab hold of patient information. Once we get that patient information, the more we have, the more we can use as a basis for improvements in analytics and artificial intelligence, and really using that data to improve the way we deliver healthcare globally. The size of the healthcare market in IT is around about 50 billion globally per annum. So it's a big market. We don't target the whole market, so we're a proportion of that, but a very big growing proportion of that. So we kind of have a fairly limitless size to our market. So our growth strategy for making the most of this growing market is looking at new market, regional markets, so looking at new jurisdictions, but also building on our existing base of sharing information across the health sector, to adding value to that, doing analytics on top of it, and doing patient engagement. So if you like, offering more services and more product on top of our existing base. So the financial profile of the business, we spend more than probably anybody in our market on R&D. So we're investing massively in our product. We believe in product-led innovation. So we've spent a lot on R&D. Roughly 40% of our revenue is on services, and the rest is licenses and support. But we're going through a transition now from a perpetual license model to a subscription model, and offering a lot more software as a service and managed service offerings. So in the short term, we're foregoing a lot of our big license fees and spreading them over the useful life of our products, which is normally a very long time. Key KPIs on our performance is our revenue growth. At the moment, I wouldn't be looking at our profit line, although it should be reduced. We've got a big loss. The reason we've got a big loss is because we're investing heavily in R&D to get ahead of our competition. But you'll see that number come back as we fix our investment in R&D and not grow it, but our revenue numbers are growing. So that's a really good indication of our success. Well, the percentage of GDP spent on healthcare every year all over the world is growing, and it's unsustainable to continue to do that. And so every health economy needs to look for change, look at new ways to deliver care, and look at improvements to health outcomes. And technology is a key enabler of all those changes. And we see a big revolution in data. There's going to be an enormous amount of data in healthcare, devices, genomics, populations of information being gathered. And so big data analytics is an area we're focusing on, and a big trend in healthcare.